Good evening, ladies and gentlemen. Today we will be talking about testicular tumors, and to be very specific, we will be talking about what a seminoma is. A seminoma is a benign testicular tumor, and it is the most common testicular tumor that is found in males. To give you a brief introduction or a background of what testicular tumors or what their origins are, testicular tumors can be divided into either germ cell tumors or stromal sex cord tumors. Now, germ cells basically are embryonic cells or also precursor cells that have half the number of chromosomes, and they divide on different paths to form mature somatic cells. So, a seminoma is basically a germ cell tumor that is seminomatous, and other tumors were non-seminomatous that were from germ cell category. Now, a seminoma is common in young males that are between the age of 15 to 40, and germ cell tumors like seminomas are associated with a range of disorders. Like if an individual he is suffering from cryptorchidism, he is very likely to have testicular tumor later in his age. Cryptorchidism is undescended testes. Undescended testes basically is that embryonically testes they develop in the abdomen, and when during the last months of the gestation these start descending and they reach the scrotal sac. Failure to do so leads to cryptorchidism. Hypospadias is the abnormal opening of the urethra on the penis. Infertility. If all of these are present simultaneously, this would be called the testicular dysgenesis syndrome, and those people have very strong chance of developing testicular tumor, that is a seminoma. Now, these lesions or these disorders may individually be present and may increase the chance of a seminoma. Now, it also has a very strong familial predisposition. It means that if someone from your family or someone from a patient's family is suffering from a seminoma, he would have a very strong chance of developing that lesion or that benign tumor later in his life. Now, as I pointed out earlier, it is the most common form of testicular tumor, and to tell you that it is often mixed with other germ cell tumors. Means if you see a patient and if you see the specimen, if you actually see the tumor, you will actually find the seminoma present with other germ cell tumors like a teratoma or a choriocarcinoma. You'll see these tumors in other lectures as well. Now, morphology. To tell you about the morphology, I'd like you to please pause the screen and note down these points. I'll repeat these points for you that it is a well demarcated or very well circumscribed. It means that the tumor has a very well defined boundaries. Homogeneous. Homogeneous means that it is very similar to its tissue of origin. Grayish white or tan in color, lobulated, and no necrosis or hemorrhagic areas. Now, you can see the gross morphology. This, where the mouse pointer is a normal is a seminoma, and this is a normal testicle on its cross section. Now, as I pointed out that it was a very well demarcated lesion, and you can see that this is a very well demarcated tumor. You can actually see the boundary over here. All of this is a very well demarcated tumor. Okay, and if you compare it with a normal testis, you can actually see lobules that are present, very well demarcated and lobulated, and also the color is grayish, sort of gray white or tan. If this specimen it matched this, we'd call it tan, but this specific specimen is grayish white. And you can see that there are no areas of hemorrhage or necrosis. You cannot see blood anywhere. It means that there are no areas of hemorrhage or no areas of necrosis that are seen in this specific tumor. So this would what you see on cross examination of the cross section of a seminoma.